Alright, how's it going? My name's Reggie Gilstrap, and this is my sub-Q injection and my oral medication video. So here we go. Alright, so the first thing that I would do is I would perform hand hygiene, um, and that's to prevent the spread of infection. I would verify, this is before I even get into the patient's room. I would go ahead and verify the provider's orders with a MAR to ensure medication and dosage are correct. For this video, what I'm given is 7 units of Humalog and 325 milligrams of acetaminophen. Um, I'm going to determine if my patient has any drug allergies um, or other contraindications to prevent any adverse reactions. So for Humalog, contraindications would be if they had low blood sugar already. And then for acetaminophen, if their blood pressure was low, that would definitely be a contraindication um, to not give the medication. So just verify that they don't have any contraindications before giving the medication. Um, I would confirm that it's for the correct patient by comparing the name from the order sheet to the MAR or the MAR to the med machine to ensure the correct patient medication. So I prefer my first med check, number one, the right patient, the right time, the right dosage, the right route, the right medication. Um, that would be my first med check, and that's just for patient safety. I would perform any med calcs and verify with a second nurse. So for my Humalog, I have this syringe that will just act like is my injection syringe. I would verify the 7 units. I would uncap, pull 7 units, pull it out, and then recap with the swoop method, so that way I don't get close to the needle or anything like that, and ensure it's capped, and verify that I have 7 units in the syringe with a second nurse. Um, I would get my 325 milligrams of acetaminophen and do the same thing. Right drug, right dose, right time, right patient, right route. Um, After I've confirmed it and got any med calcs, I would go ahead and perform my second med check before entering the patient's room to verify that all the information is correct. Um, and we're good to go to administer the medications to the patient. This was all due prior to me entering the patient's room. Now I will enter the patient's room and go through giving them the sub-Q injection and the acetaminophen. All right. Knock, knock, knock. Provide for patient privacy and hygiene. Hello, Mr. Gilstrap. My name's Joey. I'll be your student nurse for the day. How are you doing? Awesome. So what I'm here today is I have 2 medications from the provider to give you today. Today I have 325 milligrams of acetaminophen and I have 7 units of Humalog. It'll probably take between 5 or 10 minutes to administer this. Is that okay with you? Okay. So you don't have any allergies. I just want to make sure that you don't have any allergies to these medications. You don't have any medication allergies, right? No? Okay. So for the reason for these medications, Humalog, you're getting 7 units. That is to treat your blood sugar, okay, to get it to normal levels. And the 325 milligrams of acetaminophen is for pain, okay. Now, before we get started, I'd like to get 2 patient identifiers from you. So, can you tell me your name and date of birth? Awesome. Um, and on a pain scale of 0 to 10, 0 being no pain and 10 being extreme pain, how would you rate your pain? 5? Okay, awesome. Well, that's what we got the acetaminophen for, okay? So, now that I've done that, um, I would get my patient's vitals to make sure that their vitals are fine to administer the medications. Vitals were done. All my patients' vitals are within normal limits. So I'm going to go ahead and set this down. Here's a cup of water. All right, don some gloves. All right, so do you have any questions on any of this medication? Oh, what are the adverse reactions? So to Humalog, you could have a allergic adverse reaction that may result in anaphylaxis, which means like your airways are closing up, or just the normal standard allergic reactions, or you could respond with hypoglycemia, so low blood sugar, and that would create headaches, nausea, and confusion. For the acetaminophen, same thing as far as allergic reactions, nausea, vomiting, stomach pain. If any of that occurs, I would discontinue use, and I would treat your signs and symptoms. Okay. Do you have any other questions? No? Okay. All right. So I got your vitals. We're good. I'm going to perform my med check number 3. So can you tell me your name and date of birth, please? Okay. And I have your 7 units of Humalog and your 325 milligrams of acetaminophen. The Humalog will be through sub-Q. So in your fatty tissue, it'll be injected, and then the acetaminophen will be oral, so taken through your mouth. It's 325 milligrams for the acetaminophen and 7 units for your Humalog. Okay. It's due right now. And I think that's it. All right. So do you have any questions? Okay. So is there any site that you prefer to get your insulin or your Humalog injected into? Okay, your stomach. Okay, that'll work. Okay. So what I'm gonna look at is, let me just look at your stomach and make sure that you don't have any lesions, inflammation, redness, anything like that. Okay, it all looks good. Okay. So now that I've done that, I'm gonna go ahead and give it. It's gonna be 1 inch from your umbilicus. Okay. So what I'm gonna do is I need to get an alcohol wipe. I'm just gonna wipe the area next to your umbilical cord, your belly button, just 1 inch away. I'm gonna wipe about 2 inches out. Okay, and start from the center and work my way out. Is that okay? Okay. Clean, clean, clean. All right. I'm gonna go ahead and let that air dry for a minute. Okay. So I'm gonna go ahead and take the cap off. I'll let it air dry. With my non-dominant hand, I'm gonna go ahead and pinch the area that I'm injecting. And then I'm gonna go ahead and inform the patient, let them know that they're gonna feel a stick. So this is gonna be at a 90-degree angle. My patient's not thin, or older patients would be at 45 degrees. So, all right. So you're gonna feel a little stick, okay? And I'm gonna slowly inject. I'm gonna hold it there for 10 seconds. Then I'm gonna release. I'm gonna hit the safety on this to retract the needle. Then I can set it down. Now that I have that in, I'm gonna go ahead and put a bandage on it to prevent blood from leaking and all that, and keep it clean. All right, so they're good to go on that. I didn't see any redness or any bleeding on the injection site. I'm just looking for any adverse reactions from my patient. This I can go ahead and throw in the sharps container. The safety was pulled on it. I did not cap it. I'm gonna go ahead and remove my gloves, perform hand hygiene again, don new gloves, and now I'm gonna give my patient their oral medication. So I'm gonna go ahead and sit you up to 30-degree angle, okay? And that's just to prevent you from choking on the medication. All right, so in this container, I have your 325 milligrams of acetaminophen, okay? Here you go. All right, whenever you're ready, I have some water right here. You can go ahead and take that and swallow it, okay? You have no problem swallowing, do you? No? You swallow just fine? Okay. All right, can you go ahead and take those medications? Beep, beep, beep. Awesome, good job. All right. So I'm gonna go ahead and take my gloves off, perform hand hygiene. I'm gonna make sure the bed is in the low position. I'm gonna make sure it's locked, side rails are up. Here's your call light. All right, I want to thank you for allowing me to give you your Humalog and your acetaminophen. Do you have any questions? No? Okay, well, if you need anything, you just let me know, okay? Just hit your call light and I'll come in here and take care of you, okay? All right, you have a good day, okay? And hygiene, and I'm done.